Welcome to the Introduction to Facility-Based Telehealth video. In this video, the term patient refers to the patient, client, and resident. iScheduler is the software that is used for all bookings completed through the provincial telehealth program. First, we will start with an introduction to telehealth. Next, we will review the current uses of facility-based telehealth, introduce you to the equipment and software required for telehealth, go over the scheduling related to facility-based telehealth appointments, briefly review how clinicians and providers can give feedback to the telehealth program, and finally, we will briefly touch on patient registration. Telehealth is meant to simulate an in-person visit with your patient through use of video conferencing. Telehealth calls occur in a closed, secure network known as the Health Information Network, or HIN. There are currently over 110 telehealth sites in the province, in various healthcare centers, clinics, and hospitals, including acute and long-term care sites. Within these sites, telehealth is delivered via secure live video. Because we are bound in the healthcare system by the Personal Health Information Act, we have privacy measures in place, such as encrypted network, firewalls, and password-protected software. There are two basic ways that we are able to connect using video. Physical telehealth devices located at healthcare sites. Examples include portable clinical carts, desktop units, and wall-mounted options for larger spaces. Encrypted software called Jabber. This can be accessed from a regional health authority computer or personal device such as a mobile phone, tablet, or laptop. Facility-based telehealth appointments are telehealth appointments in which the patient attends from a regional health authority, RHA, telehealth site. Telehealth offers increased access to healthcare resources and reduces travel costs that may be associated with face-to-face clinics, training, and education. Some of the things to consider before starting to practice facility-based telehealth include joining your call from a space that ensures the privacy and confidentiality of your patient, identifying the technical support that you may need prior to your call, making sure that you are aware of the processes involved in setting up facility-based appointments. For example, will you be scheduling your appointments, or do you have an administrative staff support member that can assist with this process? You might also want to consider if anyone else in your office or area will need orientation to telehealth. Please share this video with anyone at your practice that may benefit from the orientation to facility-based telehealth. Facility-based telehealth can be used for individual appointments as well as for group sessions or meetings. The patient attends the telehealth appointment at an RHA site and simply answers the incoming call from the provider. However, the provider has a number of options to initiate the telehealth call. The provider can call the patient's site from a Jabber account on a personal or corporate device. Alternatively, the provider may have the option to call from a dedicated telehealth unit in a physician office or meeting room at the provider site. Not all patients and clinical scenarios are well suited for telehealth. Typically, the provider initiates a discussion with the patient during an in-person appointment to determine if there is an interest in telehealth. The provider can offer patient resources if the patient is considering telehealth. Telehealth patient resources, such as FAQs and information sheets, can be found on the NLCHI Virtual Care website. iScheduler is the provincial scheduling program that is used to book telehealth appointments in Newfoundland and Labrador. This is an application which is set up to accept bookings primarily for patient appointments. This application can also accommodate group sessions such as staff meetings, group treatment, and patient education sessions. The next section will provide an overview of the iScheduler application and the processes that are involved in booking telehealth appointments and meetings. Individual patient appointments and one-to-one healthcare provider consultations are typically scheduled electronically via iScheduler eRequest. Some staff who do not have access to iScheduler continue to use a fillable appointment request form, which can be found on the NLCHI virtual care website. Requests for group events, such as treatment or education groups, must be sent via electronic fillable forms, also available on the NLCHI virtual care website. In iScheduler, the patient site is the site where the patient will be attending the telehealth appointment, and the provider site is the site where the provider is based. There are RHA staff at both the patient site and the provider site who assist with scheduling the patient appointments in iScheduler. As an iScheduler user, you may be sending electronic appointment requests, known as e-requests, from the provider site. iScheduler users at the provider site are also responsible for contacting the patient to share the appointment details. As an iScheduler user at the patient site, you may be actioning, accepting, or declining incoming appointment and meeting requests. iScheduler users at the patient site will need to review the details of the incoming request and ensure that the room and resources required for the appointment are available. If the appointment can go ahead as requested, the appointment is accepted. If not, the appointment is declined. On the day of the appointment, it is also a site contact at the patient's site who greets the patient, brings them to the telehealth room, and assists with answering the incoming call from the provider if needed. Quite often, the site contact is the iScheduler user at the patient site. Once your e-request has been entered into iScheduler, the appointment has to be actioned, accepted, or declined by the patient site. iScheduler users at the provider site will receive an email notification when any action is taken on the requested appointment, such as accepting, declining, or modifying the request. Once the iScheduler user at the provider site receives the appointment acceptance email notification, the patient should then be notified of the appointment details. It is the responsibility of the iScheduler user at the provider site to notify the patient of the appointment details. As mentioned previously, the iScheduler electronic booking process, called eRequest, is primarily used for facility-based telehealth clinical appointment requests. This includes appointments such as patient assessments, clinical consults, and follow-up appointments. Please view the iScheduler eRequest for facility-based telehealth video and user guide for more information. Requests for facility-based meetings or group sessions are sent via electronic fillable forms and are not entered directly into iScheduler by regional health authority staff. There are two forms used to request group sessions that are available on the NLCHI virtual care website. Form 1, Administrative Use of Telehealth Equipment Meeting Request Form. Use this to request telehealth equipment for administrative purposes. Form 2. Clinical use of telehealth equipment session request form. Use this to request telehealth equipment for clinical purposes. Please ensure that you check the appropriate purpose for your session from the list provided. These meeting request forms should be faxed or emailed to the provincial telehealth scheduling coordinators at NLCHI once completed. Contact information for the scheduling coordinators can be found on the forms. Once an appointment is entered into iScheduler, a notification is then sent via email to the sites involved in the session. For meetings, however, the notification is only sent to the meeting requester, who is responsible to then forward the notification to all meeting participants. For meetings or group sessions, the email notification will also include a link to join the meeting via a supported web browser. This meeting link can be used by call participants who may not have a Jabber account or access to a telehealth unit at a healthcare facility. Please note, some providers prefer for their appointment and dialing information to be sent in an appointment whiteboard report, as opposed to receiving appointment email notifications. Please view the Telehealth iScheduler Appointment Management video for more information. iScheduler users at the patient site are able to view new meeting and new appointment requests on the home screen of iScheduler. Please view the Actioning Incoming iScheduler Request video and user guide for more information. As mentioned previously, there are numerous telehealth resources for patients and providers on the NLCHI Virtual Care website. As well, for patients considering this type of service delivery, there are applicable handouts available. The provider survey is also located on the Virtual Care website. We want to ensure that the resources and processes developed for telehealth are appropriate and effective. Please provide us feedback to help make this service better for patients and other providers. Please refer to your program for direction regarding registration processes for telehealth patient appointments. During this process, the patient and the healthcare provider may need additional support to ensure that they are ready for the telehealth call. If the provider or patient experiences difficulty during a telehealth call, please contact the technical support team. If you are having difficulty scheduling an appointment, please contact the scheduling team at NLCHI. We realize that there are sometimes hurdles when adopting new processes and technology, but the benefits of adopting telehealth are significant. Please let the RHA Telehealth Coordinator know when you come across a hurdle or a roadblock. We will work together to find a solution. Thank you for your time.